whilst I'm here in Johannesburg, in South Africa, nothing has changed really. My mission remains the same. I continue to remind you to remain on the cusp with Daphne, a place where inspiration meets evolution. I need to also add that whilst I speak to so many recruiters and employers, it's becoming more and more evident that there is a greater shortage of mental health nurses as well as theatre nurses. So if you are that person that is theatre trained or that is a mental health nurse, I need you to get in touch with me right away. Do not mind the fact that I'm not in the UK, because I will be pretty soon. Stay tuned to this channel. Don't forget to subscribe, to share, to like, and comment on this video. I am here to help you. I have told you that if you are a midwife, children's nurse, theatre nurse, or mental health nurse, your services are in such greater demand than anybody else's. I'm by no means suggesting that if you're in any other category, whether as a health care worker, as a healthcare assistant, or a general nurse, that you are not needed. However, the categories I've mentioned seem to be much more in demand at the moment above all the other ones. So if you are the person, I'm going to ask you to stay tuned so you can listen to the criteria. That's the bit I'm going to cover in the next part of the video. Stay tuned on the cusp with Daphne. So I have told you already that if you fall in the category of mental health, theatre nurse, children's nurse, or any scrub nurse, be it orthopedic or anything in theatre that's theatre related, I'd like you to stay tuned so I can tell you how you can get in touch with me. I'll tell you that at the end of the video, I do have a criteria that I have been given specifically by someone who's looking for you. So stay tuned on the cusp with Daphne so you can tell you more about this, and don't forget to share, to like, and to comment on this video. It does help a lot with the algorithms and help grow the channel. Stay tuned to On the Cusp with Daphne. Thank you.
No one can do it like you.
So I've already said, whilst there is a shortage, an overall shortage for nurses overall, the following in the speciality of mental health, the theatre scrub nurses, pediatric nurses are somewhat in much more greater demand. So I'm going to go through a criteria which I have been given by the person looking for you as somebody in that category. And my criteria is fairly longish, so I will be referring to my device to make sure I do not leave out an issue. And if you meet this criteria or you think you might do, you will then need to get in touch with me so I can put you in contact with the relevant people. Stay tuned as I go through the criteria. So number one criteria is that you need to have passed your IELTS or OET test. The second criteria is that you need to have passed your CBT or have at least been registered for your CBT in your respective area of speciality. If it's pediatrics, it will be pediatrics. If it's a mental CBT, it will be a mental CBT, etc., etc. And if you are in theatre, they have requested, or at least the requirement is that you complete the adult CBT. So it goes on to say, I'm going to read, it goes on to say a minimum of 12 months experience working as a registered nurse in a mental health ward, mental health services, a minimum of 12 months experience working as a registered nurse in children's ward, a minimum of 12 months experience working as a theatre nurse. So whilst I've told you about other companies that I'm working with that are happy for you to have less than 12 months experience in theatre, these particular ones seem to want you to have a minimum of 12 months experience in theatre. There are other ones who are willing or who are open-minded to having nurses with experience less than 12 months in theatre, and they are happy to train you further. Criteria number 5 is a little bit repetitive because it talks about candidates working clinically in either the pediatric ward in theatre or in a mental health setting, but I think the emphasis is the clinical aspect, as in perhaps you cannot be hands-off or perhaps in a managerial role where you are not as clinically involved. They would be happier if you were more clinically involved. And if you're in a senior role, this is the time for you to consider stepping down or even doing things like extra shifts or overtime or volunteering in a slightly junior role for you to be a bit more clinical. The next criteria is not very specific, but it just says no gaps in your employment history recently. So as to how long the gaps are permitted to be, it doesn't say, but even if you have gaps, just justify what they were for and put your CV forward. The next criteria I'm going to read, it says that candidates should be flexible on location for London with the NHS or private hospitals. Be flexible on locations across England. So it's just emphasis on saying that you could be placed in either a private healthcare setting or within the NHS. It could be in London, it could be anywhere in the country, but they've made it so clear to me that they have positions all over the country. So it depends where your vacancy will be filled or where you will be placed. They also say you must be able to start within 2 to 3 months for the NHS. For the private sector, you need to be able to start as required by the employee. I think this should not be an issue for many people who are already applying. You're applying because you're flexible and that you're willing to start, I suppose. And this last criterion says candidate should have completed a diploma in nursing and be on their own nursing council as a registered nurse. In brackets, it goes on to say we cannot accept enrolled nurses or registered nursing assistants or healthcare workers. So this speaks to a slightly junior role than registered nurses. It would seem at this point all they are happy to accept registered nurses. So these things do change all of the time. I will continue to inquire for other categories as I continue to work with these people, or perhaps for them to refer me to other companies that are accepting healthcare assistants. They are in the industry, they will have the know-how, and they will know who's doing what and who's not doing what. So these are the things I continue to do for you behind the scenes. Thank you for watching. This is the criteria. If you think you meet this criteria, get in touch with me. Comment on the description box below, and I will be more than happy to get in touch with you and to guide you as to how you can get in touch with these people. And if you feel you haven't met the criteria just yet, continue to work on the things that are going to help you to be eligible as well for this opportunity. There are many an opportunity are waiting for you. So remain on the cusp with Daphne, and do not forget to share, to like, and to comment below. Thank you for your support, and stay tuned for the next one.
No one can do it like you.